So autism and autism spectrum disorders form a whole group of neurodevelopmental disorders characterized by problems with social interaction, verbal and non-verbal communication, and repetitive actions predominantly present in children. This problem can extend right into adulthood, as this is basically an incurable problem. The causes of autism are several. Genetical mutation is considered to be one of the most important causes of autism. It is not a single gene that is mutated, but several genes are implicated in the causation of autism and autism spectrum disorders. The development of the child is hampered very early in the formative age, as the neurodevelopmental system is set back even from the very early stages of formation. These mutations lead to altered brain mechanisms, which in turn result in serious developmental changes in the children. This is manifested generally by about first year of age, and very often the diagnosis is before the age of 3. It is not diagnosed primarily through any other test, it is predominantly through history of milestones. As the child develops, the milestones are delayed invariably. Very hardly does a child with very severe autism become completely independent as an adult. However, the whole approach to the treatment of autism is aimed at making the children more and more independent and capable of leading a normal social interaction. Social interaction is one of the most affected aspects in a child with autism, and the child is often alone. The prognosis is far better in children with a IQ, and they are the ones who respond much better and lead. Some of them even are successful in their lives, but children with low IQ are the ones who suffer the most. However, the biggest problem is with the social interaction. The approach to treatment of autism in conventional medicine comprises of medication in some cases, which is again based on antipsychotics, as well as there are the behavioral training and behavioral and social therapies, which form a very important part in rehabilitating a child with autism. Occupational therapy and speech therapy form a very important part in rehabilitating the child to be able to lead a better social life, especially with the aspect of interacting with its peers and with the society around it. Speech skills are often very severely impaired, and even the child has a problem with eye contact. These areas can certainly be improved upon through behavioral and social interaction, interventions, as well as through speech therapy. Ayurvedic treatment offers a very good add-on to the process of treating a child with autism. Though again the treatment is not completely successful, a child doesn't become perfectly normal with this intervention. But the inclusion of Ayurvedic treatment along with behavioral therapy and speech therapy goes a long way in improving the quality of life of children suffering from autism. They are also many times accompanied by seizures and other disorders as part of the whole developmental process. These problems can also be addressed in a much better manner in this multidisciplinary fashion when Ayurvedic treatment comprising of diet, of lifestyle interventions, and therapies and medicines from the herbal medicines that are suggested in Ayurveda, when they are combined with the behavioral interventions and occupational therapy and speech therapy, the development of the child becomes much better. This is one of the things that we offer very strongly at AVN Arogya Center for Developmental Neurology. We have this entire integrated team headed by a developmental neurologist who advises the whole team and guides the team in the treatment of children with autism. With this integrated approach, we definitely hope to improve the quality of life of children with autism.